The opposition sticking to its guns on this year's budget. Another drug bust over in Grand Bahama, and PAHO expressing COVID concerns in the region. Good evening, everyone. I'm Leah Cooper with your JCN News for this Thursday, June 3rd. Progressive Liberal Party Deputy Leader Chester Cooper sounding off on the government's 2021-2022 fiscal year budget, calling it a failure, woefully unrealistic, and absolute fantasy. Contributing to the budget debate in the lower chamber, which began on Wednesday, the PLP deputy chalked up his contribution to having some good news and some bad news when it comes to the minister-led administration's fiscal plan.
This budget is sheer fantasy. It would stunt the growth in the country for decades unless its policies are reversed and reversed quickly. Don't get me wrong, there was never any question that Dorian and the pandemic would bring great economic hardship and lead to heavy borrowing. But the minister administration's navigation of the pandemic, added to the dangers presented in this budget and the accompanying communications, will ensure that things get worse before they get measurably better.
Mr. Cooper adds that the Free National Movement administration came into office promising better fiscal management, but will go down in history as the worst manager of fiscal affairs in a modern Bahamas. He contends that the budget is characterized by short-term thinking and ignorance of the severity of our debt position and reckless election nearing.
The minister administration is either incompetent or intentionally trying too hard to make these numbers work, or both. This administration believes that it would collect 18.3% of GDP or $2.24 billion this fiscal year after falling woefully short of this year's modest target of $1.76 billion. It believes that this can be accomplished despite granting perhaps an additional $100 million in new concessions. This is simply unbelievable.
Mr. Cooper suggests that it is more likely that revenue would be around 16.5% of GDP or $1.78 billion, adding that it's not as bad as the current year, but about $400 million short of the predicted target. He says the administration predicts it will collect nearly $600 million more in revenue in the next fiscal year than in this one. Yet it has met none of its revenue projections since it started its term in office.
Nothing has been presented so far to indicate that there's any realistic hope of turning this revenue story into reality. Again, on the expenditure side, we see shameless, dangerous electioneering that will have real negative consequences. Recurrent spending is increasing by more than $250 million, with a $20 million increase in wage bills and a ramp up in new hires, even as you work with the IDB to contemplate right-sizing the public service. One looks at this budget and a sinking feeling occurs when we see our administration engaged in bloated election spending as we stare down the barrel of yet another crisis.
Mr. Cooper contends that the good news is that this will be the last budget presented by the minister administration before it is voted out of office whenever the next general election is called. Off the heels of those frustrated nursing students of the University of the Bahamas taking their cries to Rawson Square yesterday, claiming that they have been denied the right to graduate because they are unable to complete clinical hours needed, which works out to more than 800 clinical hours. The Public Hospitals Authority and the Ministry of Health issuing statements on Wednesday, bringing clarity to the nurses' clinical rotation query. In a statement by PHA, the authority says that in keeping with the national protocols on COVID-19, the authority implemented measures dating back to March 2020 to ensure the safety of all persons entering its institutions and agencies. These protocols also govern the facilitation of clinical services and training programs. It further states that the PHA confirms on Monday, May 10th, students from the Trained Clinical Nurse Program commence their 14-week rotation in the clinical environment environment of the Public Hospitals Authority, starting with the Princess Margaret Hospital. Logistics pertaining to the re-entry of the Bachelor of Science nursing students is expected to be completed shortly. Meanwhile, the Ministry of Health in its statement notes that the ministry continues to collaborate with the Public Hospitals Authority and the University of the Bahamas to safely continue the phased re-entry approach to the nursing students into the clinical environment. Bahamas Nurses Union President Amancio Williams, who only represents licensed nurses, was out in support of the students yesterday. The country's COVID-19 death count increasing yet again as the Ministry of Health confirming another 2 unfortunate deaths, a 77-year-old and a 70-year-old, both males and both of New Providence. They died on Sunday, March 30th. These deaths pushed the national death toll to 232. 28 deaths remain under investigation, according to the ministry's recent COVID dashboard. Total infections in country has also increased. Health officials confirming that out of 396 tests completed for Wednesday, June 2nd, 37 returned positive for the virus. Again, New Providence with the bulk of the cases, with 24 confirmed, 7 with a history of travel within 14 days, Andros with 5, Abaco with 4, Eleuthera confirming 2 cases, and Long Island and Cat Island each confirming 1 case. These new additional cases push the country's total confirmed cases to 11,930. Active cases now stand at 685. Hospitalized cases have increased. On Tuesday, 49 people were in hospital. As of yesterday, 51 cases are hospitalized, 5 in the intensive care unit, with 29 recoveries on Wednesday. Recovered cases tally at 10,932. The Pan American Health Organization calling for more active steps to curb the spread of COVID-19 in the Americas region. Director of PAHO, Dr. Carissa Etienne, reports in PAHO's weekly press conference on COVID-19 that since the start of 2021, COVID-19 cases and deaths have almost doubled in the region, and it is a cause for concern.
Wishful thinking will not solve or resolve this crisis. We need action. So please let me remind you of what needs to be done to stop this outbreak. The first thing is effective leadership. This pandemic has taught us time and again that leadership determines the effectiveness of a country's response. Sadly, across our region, we've seen misinformation about COVID-19, and this has sown the doubt on proven health measures, and often in the context of political disputes. By stoking controversy where there is none, our leaders are sending mixed messages to the public.
Dr. Etienne says these mixed messages can stand in the way of effective measures to control the virus. She urges government leaders to unite against stopping the virus, as it must be the first priority. The second priority is vaccines.
The second is to urgently boost access to vaccines. Effective vaccines are a beacon of hope in this crisis, and we must do all in our power to secure more doses for all nations in the Americas. We are very far from this goal, especially for the low-income countries that are still struggling to protect health professionals and those more vulnerable.
To date, the COVAX facility has delivered some 17.6 million vaccine doses to the region. However, Dr. Etienne says that the rollout of vaccines is not keeping up with the pandemic. You're watching JCN News. Stay with us.